If you took Accutane, or Roaccutane, or Absorica, even 10 years ago, even just for a 6-month course, in high school, there is a 7-stage ladder underneath your liver, and most people who climbed it walked away without a single follow-up blood draw. The drug ended. The damage did not. This is what isotretinoin does to your liver, stage by stage. The first 6 stages are reversible. Stage 7 is where the liver does not come back. Stage 1, lipid disruption. Within 4 weeks of starting the drug, your triglycerides spike 30 to 50%. Total cholesterol climbs alongside them. The mechanism is brutal. Isotretinoin shrinks the sebaceous glands across your skin. The oils they used to make have to go somewhere. That somewhere is the bloodstream. A sudden flood of free fatty acids arrives at the liver every hour, every day, for 6 months straight. Stage 2, hepatocyte stress. Your ALT and your AST start climbing. Mild transaminitis appears on the monthly blood work the FDA requires. 15 to 20% of patients on isotretinoin show this elevation. The hepatocytes are working harder than they were built for, leaking enzymes into the blood as they strain. The dermatologist looks at the numbers. They are under 3 times the upper limit. The drug continues. The blood work is filed. Stage 3 is already underway. Stage 3, cholestatic phase. Bile flow inside the liver slows. Not enough to turn your skin yellow, just enough to back up at the smallest ductules. Alkaline phosphatase begins to rise on the blood work. It is the number most dermatology offices do not order. It is also the number that catches this stage. You feel nothing. There is no jaundice yet. There is no itch. The bile is sluggish, and the liver is quiet, and stage 4 is already underway. Stage 4, steatosis. Fat starts to accumulate inside the hepatocytes themselves. The cells fill with amber droplets that displace the nucleus. This is mild fatty liver disease, drug-induced. An abdominal ultrasound would catch it in 2 minutes. The radiologist would call it bright liver. Almost no Accutane patient ever gets an ultrasound. The drug ends. The acne is gone. The fatty liver stays. No one looks for it. Stage 5, fibrotic bridging. In a rare subset of long-term users, scarring begins. The hepatic stellate cells in the space of Disse wake up. Activated stellate cells lay down collagen between hepatocytes. The collagen forms thin bands that bridge from one portal tract to the next, dividing the parenchyma into islands. The liver loses elasticity. It cannot regenerate through scar tissue the way it regenerates through healthy parenchyma. Caught here, the fibrosis is still partially reversible. Almost no one catches it here. Stage 6, drug-induced hepatitis. In approximately 1 in 10,000 users, full hepatitis develops. The ALT rises above 10 times the upper limit of normal. Jaundice may appear. The whites of the eyes turn yellow. The urine darkens. Fatigue settles in the muscles. Nausea arrives in the mornings. When this is caught on blood work, the drug is stopped immediately. Most patients recover. The blood work normalizes within 6 to 12 weeks. The liver gets a second chance. Stage 7, acute liver failure. In a handful of documented cases, the liver decompensates. Synthesis of clotting factors collapses. The blood will not clot at the draw site. Ammonia builds in the bloodstream because the liver can no longer convert it to urea. The brain absorbs the ammonia. Confusion arrives. Then disorientation. Then encephalopathy. The patient stops recognizing the room. The fibrosis, the fatty infiltration, the inflammation, the failure of synthesis, all 4 converge in the same week. Transplant evaluation begins immediately. Sometimes a donor arrives in time. Sometimes the patient does not. The blood work showed the warning. The drug was stopped too late. The acne went away. 1. The liver did not come back. There is no symptom at stage 3. There is no warning at stage 5. There is no coming back from the failure at stage 7. If you took isotretinoin in the last 10 years, do 2 things. This month, before your next dermatology appointment. Get a liver function panel. Ask specifically for ALT, AST, and alkaline phosphatase. If any number sits above the reference range, ask your dermatologist for an abdominal ultrasound. The scan takes 2 minutes. It is the single test that catches stages 4 and 5 before they become permanent. Send this to anyone in your family who took the drug for their skin. The next video goes inside a different organ that the same drug also quietly visits.